Hello, Wink Nation. Thank you again for joining us for an exclusive broadcast and interview for Wink Goes Red Computer Love. Yes. Thank you so much for joining us. And if it's your first time joining us, or if you haven't even heard of Workmanship Incorporated before, Workmanship Incorporated, also known as Wink, is a creative collective with a mission to reach the heart of the world by sharing various forms of creative expression. And Wink Goes Red is our annual outreach event designed to encourage heart health in our communities. So Wink Goes Red Computer Love is vibing off of the times that we're in, where we are confined to love each other through the computer screen or just virtually. So thank you so much for vibing with us and joining us. And we have a very, very special guest today with us, and that is Dr. Celeste Reese Willis, also known as Dr. Celeste. And Dr. Celeste is one of the leading experts in urgent care and is a board-certified family medicine physician. Dr. Celeste, thank you so much for joining us. Thank you so much. I would love for you to go on and tell us a little bit more about yourself, if you will.
Oh, awesome. Thank you so much for having me. I'm so delighted to be here and so delighted to share in something that's so important when it comes to the field of medicine, especially when we're talking about going red or talking about heart disease. My name is Dr. Celeste Reese Willis. As you said before, I'm your board certified family medicine physician. I assist and love what I do in assisting busy professionals to find solutions for their medical needs, both acute and chronic. I do this via my direct primary care, via my COVID-19 testing, via my telemedicine platform, as well as through my brand new Amazon bestselling book, Vitality. So very delighted to be here. This is a super important topic and very excited to expound upon it.
I'm so happy to hear you say that, because we're going to dive right into it. Heart health is very near and dear to our hearts. All of us within Workmanship Incorporated have in some way been encountered with a loved one or even a personal story of heart health or heart disease. So let's get into our first line of questioning. Basically, we're going to be doing a question and answer session for all of you guys listening in the chat or listening on Facebook Live or YouTube. If you all have any kind of commentary or anything, feel free to put it in the chat. So the first question that we have is water important to being heart healthy?
So water happens to be one of my favorite topics. So to answer the question, absolutely, water is very essential to being heart healthy. Water helps to clear out very bad things that are in our body, like viral particles, bacterial particles. It's a cleansing mechanism for your body. So if you don't have enough water in your system, if you don't have balance, what we call water balance, you run the risk of becoming dehydrated, and that can affect your heart in several different ways. A lot of times people that are dehydrated can end up with an arrhythmia or having an increased heartbeat or heart rate as a result of that dehydration. That over a long period of time is something that could cause you some issue. If you are dehydrated over a long period of time, you also have to be concerned about it affecting your kidney function. And why that is important is because your kidneys act as a filter. Water is used as a main mechanism to help with that organ system. So if you don't drink enough water, it affects your kidneys, and it therefore will affect your heart indirectly as a result of suffering with dehydration. So absolutely, water is very, very essential. It also helps to boost your immune system, which can put less taxing work on your heart. Whenever your immune system is down, you're putting a lot of work on the other organs in your body, including your heart, and having adequate water balance helps to prevent that.
Wow. How many glasses of water or how many ounces of water should one have per day?
So for adult women, we typically recommend about 2 liters of water a day. For adult men, about 3 liters of water a day. If that's challenging, the easiest way I tell some of my patients when they come into the clinic is, okay, let's take your weight. So let's say you weigh 150 pounds, divided in half, and that's 75 ounces of water you need to drink a day.
Okay.
Yeah.
It's super hard for me to drink water. I don't know why.
Well, I will tell you this though, once you start drinking water on a regular, especially if you're someone that, I don't drink that much water, you'll be amazed how much your energy level will increase. You'll be amazed at how much more alert that you will feel. You'll have an overall better sense of your body and how you feel with an increase in water intake. It's amazing.
Yes, totally agree. I really need to get on that. Okay, so the next question that we have from our panel of questions, if you will, can one exercise too much?
So I'm going to answer that question in two ways. Usually not. They're very, very, very specific situations, as in one is exercising too much. The amount of exercise we all should get, average people should get on a daily basis, is at least 30 to 40 minutes of cardiovascular aerobic exercise at least 5 days a week, right? Okay. So some people exercise about an hour a day. Some people are fortunate and lucky enough to have 2 hours in their day that they get to exercise, which I think is fabulous and phenomenal to be able to have that amount of time. Right. The people that we talk about, the only people that we talk about that exercise too much are people that fall into a category of having some kind of eating disorder, wherein they're already underweight. And so you have to be concerned about them exercising too much and that being something that can affect their heart. But that actually also has to do with the disease process of anorexia. And so in those patients, we sometimes will say, hey, this patient is exercising too much. However, 95% of us do not exercise enough. So no, there's not typically a thing of, oh, you are exercising too much. Now, there may be certain forms of exercise that you may be doing too much that may cause you to have other ortho issues. But from a standpoint of your heart and you exercising too much, unless you're someone that's exercising 4 or 5 times a day, 7 days a week, then we would say, hey, that's a bit excessive. But exercising about an hour a day, 5 to 6 days a week is something that's consistent and considered a good thing to do.
Right. So by and large, exercise is your friend concerning heart health.
Correct. Yes, absolutely. Exercise, it helps to condition your heart is what exercise does. And why you want that is because as your heart's being conditioned, right, that means that it's pumping better, it's functioning better. That means also that you would likely have better blood flow to the other major organs in your body, like your brain, like even back into your heart and your lungs and even your kidneys, which are very, very sensitive. So there's not typically a situation where you say, oh, you're exercising too much. It can be too much on your body. So that's not something that we typically hear or worry about or that kind of thing. But the conditioning that occurs with exercise is something that has been shown to be prevalent for people that live longer. Tend to be people that exercise on a regular basis. And that has to do directly with the conditioning of their heart muscle that occurs when they exercise on a regular basis.
Right, because the heart is a muscle, and so we have to work
it is. Okay. Yes, it is. The heart is a muscle. So you have to condition it, you have to exercise it. And so but it's amazing the difference that occurs in people that exercise and people that don't exercise. There's a huge, huge difference, especially when you get to the point where you're talking about being over the age of 30 years old, 40 years old, 50 years old. When you're in that age range, you're deciding now how healthy you're going to be later on, depending on your exercise practices.
So the next question that we have is, are there certain heart healthy vegetables that are beneficial versus others? Like, can I get around with eating French fries and that's considered a heart healthy vegetable? Or is it only broccoli and asparagus? Or like, I don't know, help me out. Because I don't hate vegetables. Don't hate vegetables. I'm getting better at liking vegetables. But there's definitely a love-hate relationship between me and vegetables.
Okay, so just like the water. So when you, and I'm going to answer your question, but I'm going to go back to it. So just like the water, whenever you see or have a choice, let's say if you're out and trying to decide on, should I drink water or should I have that coffee or that Coke? The water equals life to your body over longevity. It's going to help you feel better. It's going to help every organ and muscle and cell system in your body function better. Water helps to do that. Now, it's the same concept when we talk about vegetables and we talk about our food choices. Now, absolutely, there's certain vegetables that are known to be heart healthy, like leafy green vegetables like spinach, like kale. There are other foods that are considered heart healthy as well, such as whole grains, beans, avocado, fatty fish like salmon and mackerel. Fish oil definitely is heart healthy. Walnuts, dark chocolate, even. All of those are heart healthy. All of those are heart healthy.
Yes,
now,
chocolate.
So let's talk about your choice, though. So if you're sitting and you have a choice of a spinach or kale salad versus French fries, let's talk about the difference in that choice. Now, that French fry is a potato, which is not a leafy green vegetable, and a potato in and of itself is not something that's harmful. But when you take that potato and you cut it up and you dip it in grease, hot grease, then it's, you're dealing with oil and cholesterol, and you have to worry about your cholesterol level, which one of the risk factors for having a heart attack and or for heart disease is having high cholesterol. So some of the things that we have to consider is doing everything. And that's not to say that, hey, you know what, Jessica, you can never have French fries ever in your life. We're not saying that, but we are saying that depending upon your risk factors, you may need to be someone who says, hey, you know what, I need to make sure that I choose the spinach and kale 75 to 80% of the time, and the French fries the lesser percentage of the time, to help decrease my likelihood of heart disease, especially if I have family history. And I won't go into family history now because I know that's one of our questions, but we'll go into that in just a moment. So the French fries, as much as we love them, and I love them too, are not the heart healthy choice. You've got to get leafy green vegetables. Spinach and kale should be a regular choice for you in your diet. Should be a regular choice, like on a regular basis. You should be eating spinach, kale, broccoli, leafy green vegetables. So I'll stop there because I could easily go into I know it's a question we have coming up.
Oh, okay, because I was waiting on collards to come up on the leafy green vegetables.
Right.
Okay, cool.
But now, and to answer, now collard greens are a lot better than French fries.
Okay.
It's still a green vegetable. Do you see? French fries are just not. They are full of cholesterol. They taste really good, but they're full of cholesterol.
Oh, okay. Mm-hmm. I mean, I see what you're saying. They taste amazing, though.
Right.
But I get it. Not the time and place for your heart health. Fine. Mm-hmm. No, there's so many different ways to prepare leafy greens too, that aside from just salad, that make it appetizing. Like sometimes I put spinach in smoothies. Like I'll grind it up, put them in smoothies. I'll do the same thing with kale. If the spirit moves me. But yeah, because if I found ways of getting around just eating them whole, if that's not the flavor that I want, I'll disguise them in ways like that.
Yes, exactly.
On the same page. All right. So next question that we have, it's said that laughter is medicine. Is there any correlation between laughter and its effect on your heart? Are there any benefits, or is there no effect at all?
So the old school myth, laughter is good for the soul, is actually true. It actually is a myth that is actually true. Laughter, when you laugh, you release what are called endorphins, which are chemicals that are released from your brain that help to do a lot of beneficial things for you physically and health-wise. One of the main things that happens is that laughter causes an increase in endorphins and serotonin and causes a decrease in pain, a decrease in anxiety, as well as a decrease in any, let's say, stress, so to speak. So laughter releases chemicals that help to calm and ease your body, right? As it's calming and easing your body, it's also going to calm and ease your heart rate. It's going to calm and ease you mentally as well because of the release of those endorphins. So that has a direct correlation because of countering. We know that when people get very angry and that when people get extremely stressed, they put a lot of work on their heart. You can get an increase in your heart rate. You can get an increase in your respiratory rate. And this puts a lot of stress that's on your heart. So the counterculture of that is relaxation, which is what you get when you laugh. You release endorphins, serotonin is released, and a lot of decrease in anxiety. There's a decrease in the perception of pain, even when people laugh more. So absolutely, it's something that can be helpful for your heart in that way, and that it has a calming effect on your body.
Oh, wow. Did you say there's a decrease in your perception of pain when you laugh? Wow.
Mm-hmm.
Like
yes.
physical or emotional or both?
Yes, both.
Wow.
Mm-hmm. It's because of the chemical that's released.
That's incredible.
Mm-hmm.
So workmanship loves to laugh. So we we love to laugh, love to make each other laugh, love to make other people laugh. And that's really good to know that that's like something free that you can do to just improve your heart health and improve your mood and improve just your overall functioning just by laughing a little bit.
Right, exactly.
Incredible.
Exactly.
Okay. So the next question that we have are, what are some practical steps that I can take to support the heart health goals of others? And what we mean by that, like, let's say we have a family member who we know could be doing better or could improve in how they're going about their heart health, but they're either reluctant to do it or maybe they're just not knowledgeable. How can we help them achieve their goals or encourage them?
Okay. So I think there's a two-part process to that will be helpful for that patient. The number one thing that I would tell you to do, because our words, what we say, are very powerful to someone who is dealing with a challenge or an affliction or trying to get through a situation or trying to deal with something. So the first thing you want to make sure that you do is that you are verbally supportive of this person and emotionally supportive, and when I say that, what I mean is, a lot of people say, well, I'm supportive. I told them they need to. So it's the way that we do it also. And that you don't want to degrade the person and make them feel worse than they already do because their health is in the state that it is. So you don't want to say, well, if you hadn't eaten, those French fries for, 3 months, then you wouldn't have gained this weight and you wouldn't be in this problem. Don't shame them. Don't make them feel worse than they already do. That's going to help to decrease their motivation to get up and actually do something about it. For some people. Now, some people work in such a way that they respond to that. But in a lot of situations, whenever a patient is already dealing with a challenge, especially if it's something related to, obesity or heart disease or high blood pressure or diabetes, they're already sensitive about that condition in and of itself. So having someone that is a family member, a partner, that will say, hey, I'm going to support my wife. She, needs to, lose 10 pounds and we've got to completely change up our diet. So, what I'm going to do? First of all, I'm going to verbally support her. I'm going to let her know that, hey, the most important thing now is that you're going to do something about it, not shame her about what she's done in the past. So that's the first thing. So that mentally that person feels like, okay, I'm encouraged to take a step and do something. And there's someone here who's verbally encouraging me besides my physician, who should be verbally encouraging you as well. Second thing is that you want to make sure that you validate their desire to make change and allow them to challenge themselves. So if they say, hey, you know what, I've got to do something about it. So let's say you're like, okay, I'm here to support you. You've given them the verbal support. You let them know, hey, I'm going to support you verbally. The next step would be, hey, you know what? Why don't I do this with you? Why don't I share in responsibility? Why don't I walk through this with you? It is amazing the difference in what will happen with a patient if they have support of their family, their husband, wife, partner, friends, etc. If they have that support versus them feeling like they're in it by themselves. Everyone in the house is eating, pizza every day and hamburgers every day and never eating anything healthy. And they're in this hollow place by themselves, right? So having a partnership, having someone else, if it's someone that lives alone, find a partner or someone that you can say, hey, you know what, we're going to be heart healthy together and make that change. And then the last thing I would say is probably just kind of challenging them and, saying, hey, if it's if it's a situation where you're a parent and it's a child, offer that child some kind of reward in addition to encouraging them verbally and doing it with them. And when I say that, I mean, I don't know the SP, the PlayStation games or whatever it is that you want to say, hey, if in 30 days you've lost your 5 pounds this month, you're going to get this game. And that they've gotten their schoolwork, because you don't get a game without schoolwork, of course. But something like that, so that they feel encouraged. And that they've set a short-term goal for themselves to say, hey, you know what? I'm going to enact this change. I'm going to verbally commit to doing it. I have an accountability partner, someone that's going to hold me accountable. And then I have someone who's actually going to do it with me. That has shown to be very successful in helping patients that are challenged to make drastic changes to try and improve their heart health.
Ooh, Dr. Celeste, you said a lot in that one. You came at us with the psychology aspect of it, with reward, and I kept hearing in my head bearing up one another's burdens, which is definitely something that I get out of scripture, and just the notion of just loving somebody. And that's how you just love somebody, wanting to be in it with them, wanting to not come at them with the criticism so much as with just love, and not wanting to chastise them, but just to support them. And like, I think that is a lesson that we all can lose sight of when we have the biggest goal of really wanting to help that person, but we only know how to just kind of beat them over the head with what we know that they need to know.
Exactly.
Right. And coming at them with love, I feel is I would agree, is a tried and true proven way of improving somebody's well-being or getting your point across in general. And I especially loved, because my background is a bit in psychology as well, the whole reward system aspect with the children who don't necessarily always respond to other methods, but they know darn well that if you take away my PSP, my Nintendo Switch, or my what other gaming system that they have, they don't want that. And so it's like, well, let's get our act together.
Exactly.
Okay, and same thing for us. If you take away my chocolate, ooh, bad day. It's a bad day. Before we roll on, I want to remind you guys, please continue to interact with us in our chat. If you're watching on YouTube, comment in the comment section, leave us a comment about any heart health goals that you may have, or any questions that you may have that we may be able to pose to Dr. Celeste on a later date, and post the answers on our social media or on our website at workmanshipincorporated.com. If you're on Facebook Live, leave us a comment in the chat, and we want to continue to interact with you. We're saying all that to say that we want to interact with you. We want you to learn. We want you to be connected with us in this space. We're going to go on to our next question. And thank you so much for answering them as well as you've been answering them so far, Dr. Celeste. How often should we get, you know what, this question before that one. This was my question, actually. What is a good resting heart rate? Because my Fitbit will tell me one thing, and I'm like, is like a 67? Like sometimes I'll see 67 or 50 something, and I'm like, what does that mean? What is a good resting heart rate?
So a good resting heart rate, on average, 60 to 80 beats a minute is considered a good resting heartbeat on average. Now, that the average heart rate that we expect for different individuals does vary sometimes based on your age. So, but it sounds like that 57 or that 65 that you have is an excellent resting heart rate. Absolutely excellent. Anything over 100 is concerning. And I would have to say, definitely see your physician. People that exercise tend to have a resting heart rate that typically can be in the 50s, 60s, sometimes 70s, but it usually hangs out in that 60s range, people that exercise on a regular basis.
Okay. Wonderful. Wonderful to know. Because again, that's like for someone like me who's not well versed in heart language, I don't really know what that means when it tells me that. I'm like, ugh. So like, is a troublesome heart rate, you said higher than 100
Yes.
beats per
Hmm.
minute? Okay.
Correct.
Does that mean that 80 is a bad resting heart rate, or is like a not
No,
so
no, no,
good?
no, 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 no. 80 to 100 is not a bad resting heart rate. There's some people that will have a resting heart rate in their 80s, 90s. Uh, what your resting heart rate and what it averages varies a lot based on what your age is. So for people that are older, and it depends on a lot on what medications, if any, that you're taking. All of that plays a factor. So for someone that is younger, has no, medical problems, no issues, and it not much going on, and in fact, in a lot of older adults as well that exercise on a regular basis, have minimal medical issues, they can have a resting heart rate where you'll see that in their 60s. Sometimes older patients can, but a lot of times that can be a side effect of some of the medications that they're on. So it just kind of depends. So there's no absolute, so to speak, but I will tell you that a good resting heart rate, and for people that exercise on a regular basis, having a heart rate in the high 50s to 60s to low 70s is very, very common. And so if it's between 80 and 100 doesn't mean something is wrong. That just means that you may be someone who doesn't exercise as much. Um, so your resting heart rate is a little bit higher.
Okay. How often should we get routine heart checkups? A lot of us get checkups or go to a cardiologist when something is wrong. But is there a certain routine that we should go by, or frequency that we should actually shoot for heart health?
Okay. So in general, and a lot of this depends, of course, on your age. But what I'm going to say, if you're someone that's between the ages of 18 and 65, you definitely should get an annual exam with your physician every year. What test your physician performs at your annual visit is based largely on your personal medical history as well as your family medical history. So there's certain things that we will do. If you're someone that has family history of heart disease, there are certain lab tests that I know that I'm going to order when I first see this patient, when I see them annually. There's certain things that we're going to review and talk about. Some of those things we've already discussed, discussing our diet, discussing our water intake, discussing exercise, and other risk factors for heart disease. And the reason is that person that has that family history of heart disease, you can do something about it. You can do something about it. You can do something about it. You can't change your genes, but what we do environmentally plays a large part and role in our heart health. So if you know that you have family history, and I'm probably getting ahead of myself a little bit, but I've already brought it up, so I'm going to go into it.
Go ahead.
I have family history of heart disease. Right before I went to medical school, or right when I was in medical school, my second year of medical school, I had a situation occur where my mom told me that, I was in Dayton, Ohio. I went to med school in Ohio. She was in Montgomery, Alabama. She said, I feel kind of funny. Something just doesn't feel right. I feel a little tired. And when I walked outside, I felt just a little short of breath for a few seconds. Now, I was in med school, so I was learning about these signs and symptoms, correct? Mm-hmm. So when she said that, it immediately clicked with something my professor had said to me a few weeks earlier when we were talking about heart disease. So I immediately had her call her physician. Long story short, she ended up going in the next day, ended up having a four vessel bypass surgery 2 days from then. Now, because I learned at that moment about my mom, and there's no one else in our family that had heart disease at that time, that completely changed how I filtered even medicine in general and what it is that I do. But for me personally, at that moment, I said, you know what, my mom has heart disease. And as I was learning about it, I know, we learned about the risk factors for them: high blood pressure, diabetes, high cholesterol, smoking, and family history. 5 biggest risk factors for heart disease and stroke. So what we also learned is the importance of what we do with those risk factors. So I made a decision at that time to know exercising on a regular basis is not a choice for me. I have to do it on a regular basis to prevent myself from having heart disease like my mom. So that's the first thing I ingrained in my brain. And the people that have family history of heart disease, you wrap your head around, because that's the longevity. That's one of the biggest weapons that you have to fight against getting heart disease, is exercising on a regular basis. The other things that go into that are your diet and knowing that you have to have your cholesterol checked on a regular basis. Well, guess what else? Exercise helps to lower your cholesterol as well, right? So that helps to decrease one of the risk factors for heart disease, even by exercising. The third thing, I knew that I had to monitor my blood pressure on a regular basis, as well as having my blood sugar checked, because she was also diabetic on a regular basis, because these are all the risk factors. So when you learn what your family history is and what those risk factors are, you kind of have to model and change your choices and the things that you do to try and fight that. But it's not something wherein, oh, I have family history of heart disease, so I just have to succumb to it. No, you can make a choice and say, hey, you know what? My grandmother suffered with this. My father suffered with this, but I don't have to. I can make choices today that will make a difference in what will happen to me 5 years from now, 10 years from now, 20 years from now, 30 years from now. And it starts the moment that you know that, and you making up a decision to say, hey, you know what? I'm going to take control of this risk of heart disease, of cardiovascular disease. I'm not going to let it take control of me. And so that was a decision that I made. That is a decision that people that have family history of heart disease, that I encourage them to make. You have a very large role in how you end up. And just because you have family history of heart disease doesn't mean that there's nothing that you can do about it. So it's about making a choice for what you know is best for you and best for your family.
Right. Could you go back over what the 5 major causes of heart disease is? You ran through them real quick.
Oh, absolutely. So there are 5 major risk factors for heart disease. And this is something that you should always, if you have family history of heart disease, these are questions that your physician will probably ask you and want to know. And those 5 risk factors are: number 1, the risk factor, the fact that you have family history of heart disease, that is a risk factor. Number 2, having high blood pressure. Elevated blood pressure is a risk factor. Number 3, having diabetes is a risk factor. Number 4, having high cholesterol is a risk factor. And number 5, smoking is a risk factor. So 5 risk factors for having a heart attack or having a stroke.
Right. That hit home with me just because diabetes just runs rampant through my family. We're constantly, the whole side of my dad's family, it just runs like wildfire, because we just have a history of having a sweet tooth, have a history of cooking a certain way. And it's been a struggle to break that curse, if you will, over that side of the family. My dad has taken several strides in trying to change his diet and like trying to change his habits, because we just don't want to go through the same headache that we saw my grandmother or Big Mama go through, and all her sisters and siblings and so on and so forth. So yeah, I love that you were able to break it down the way you did, because there's so much tied to our heart health. Smoking is a big one. You said diet and exercise, diabetes, high cholesterol, and I know I missed one, but
so, yeah. And that again is high blood pressure, high cholesterol, diabetes, family history, and smoking. So those are the 5 risk factors, but there are environmental factors that play a part that put you at increased risk. And that would include obesity, someone that does not move around much, someone that is very sedentary, having a sedentary lifestyle is considered a trigger. Someone that eats a lot of fatty foods, that's considered a trigger.
Wow. Okay. Thank you for that. That's great
welcome.
Information as always. But our next question is coming from, how often, or I feel like I've run over that one already. Excuse me.
How often? So, and let me piggyback on that. We said at least once a year you want to see your physician. If you're older, there's certain tests that we do to screen you for heart disease if you start having, and the main thing is that if you're having chest pain at any point in time, see your physician. If it's severe, go to the emergency room. Do not play with that. Just go ahead and do it. So that some people will go see their cardiologist or come in at, more often for a check than once a year, but at least once a year.
Thank you. What causes some people to be affected by heart murmurs and some not to be affected by heart murmurs?
Oh, great question. So a lot of that has to do with your past medical history and some environmental things that we do. Whether or not someone has a murmur or not, a lot of times has to do with the structural anatomy of that person's particular heart, whether or not when they were born that their valves, which there are 4 chambers to the heart, between each valve, between each chamber of the heart, there is a valve that flips open and closed to allow blood flow to move throughout the heart, into the lungs, and into the rest of our body. So whenever you have issue with some of those valves, that can cause you to have a murmur. If you're someone that has an increase, or let's say that your heart muscle, there's a lot of stress on your heart muscle. Let's say that you're someone that goes a long period of time without controlled blood pressure. Because when you go for a long period of time with uncontrolled blood pressure, you put a tremendous amount of work, extra work on your heart. Okay. Mm-hmm. When you do that, your heart is pumping very rigidly and fastly. So that heart muscle can become what we call rigid. That sometimes can cause people to have a murmur. Dehydration can contribute to it or exacerbate it in certain situations, but typically there's something that's wrong structurally with the heart that causes people to have a murmur. Now, some people are born with murmurs. Some people develop murmurs. Whether you were born with yours or whether you developed it is something that you'd have to contact your physician and find out, because when they listen to your heart when you go for a visit, that is something that we can hear with our stethoscope.
Is one worse than the other, being born with it versus developing it?
It depends on what kind of murmur that it is.
Ooh.
It depends on what kind of murmur. There's some things that can be fixed, and when you have a child, and it's a lower percentage of children that are born with murmurs versus the murmurs that you get in adults. Okay. Because there's a lot that we've done to ourselves sometimes that will contribute to us having a murmur, like never drinking water, never exercising, and or having your blood pressure. If you walk around with a blood pressure of 180 over, 70 for a year.
That's bad.
Or for 3 months. Yes. That is very
mm-hmm. Okay. What is a good, I believe it's diastolic systolic?
Blood pressure. Correct. 120 over 80 is the desired blood pressure. If you're 130 over 80 or less, you're considered to be still non-hypertensive. At 130 to 140, we call that the first stage or mild hypertension.
Okay.
Mm-hmm.
Ooh. Okay. Mm-hmm. So it's a good rule of thumb not to have it at 180 over what you said?
180 period. 180 period. If your blood pressure is 150 or 160 on a regular basis, go to your doctor, get some blood work done, be evaluated, find out why. 180 and higher, we worry about strokes, especially if that top number is over 200 or that bottom number is over 100. We worry about you having a stroke. And younger people are having strokes, specifically African Americans are having strokes at younger ages. We're seeing an increase, an uptick in that in the last several years. So it's something to pay attention to. So please pay attention to and monitor your blood pressure over a regular basis, please.
Goodness, I don't think anybody, I don't know if I want to make that broad generalization, but I think it's rare for younger people to check their blood pressure because you just think, oh, if I'm young, it's fine. Right. But you're telling me that people younger and younger are having issues.
Correct. So gone are the times that we can say, oh, I'm young, so nothing's going to happen to me. You just should check your blood pressure on a regular basis. You can go to any fire station or clinic and they'll check your blood pressure for free.
Right. You see them all the time. Like you go by the pharmacy and the grocery store and they have a station. Okay. Goodness. All right. Next question. Let's see. What are the warning signs before the major warning signs?
So you said the warning signs of not having good heart health.
Yes. What are the warning signs before the major warning signs of poor heart health in both men and women? So like not the warning
for
signs
having a heart attack.
Yeah, like I don't want the warning sign like where it's you're just about to have the heart attack. Is there something to look for before that one?
Other warning signs. Okay. Yeah. Other warning signs are going to be the number one thing we just talked about is having high blood pressure. Mm-hmm. If you know that your blood pressure is elevated on a regular basis, you need to see a physician and find out why it's elevated, have some blood work done, have an EKG done, possibly, if your physician feels like that you need that. If I see a patient and they have a, very large elevated blood pressure, getting an EKG and getting some blood work is something that we'll do. And you take a look at that to make sure. And what an EKG is, it's an electrocardiogram. It's just like a little snippet. It's the electronic conductivity of your heart that we see on this little sheet of paper that we call an EKG. And it helps to give us information about whether or not your heart is functioning or beating the right way. It gives us signs. There's signs of people that could possibly have a blockage or possibly have decreased blood flow or decreased oxygen flow to a certain portion of the heart. So having that elevated blood pressure is something that'll tell you then. But if you're someone that becomes very fatigued out of nowhere, and or someone that gets short of breath, let's say that you used to be able to walk up 2 flights of stairs, and all of a sudden you're not able to do so now. The main warning signs for a heart attack are having chest pain, having left arm pain. Typically, you can have pain on either side, having neck or jaw pain, as well as feeling nauseated, breaking out in a sweat. All of those, you can feel short of breath. You can also feel like, I feel like something isn't right. These are some of the symptoms that patients will describe. Now, those are the acute signs that some people have when they're having a heart attack. Now, the scarier part is not everyone has signs and symptoms when they've had a heart attack. Sometimes people can have what's a silent MI. That is why it's important, if you have family history, to make sure that we're watching on a regular basis. And you say, okay, well, if you can have a heart attack and not really have symptoms and not know it, what can you do? What can you do? It's going to go back to those same basic building blocks we talked about at the beginning of this. And that is monitoring for those 5 risk factors. Everything is essentially centered around making sure those 5 risk factors are in check. And that means making sure that you monitor your blood pressure on a regular basis. Get a blood pressure monitor. Keep it at your house. If you have family history of heart disease, you need a blood pressure monitor in your house. You do. You can order it on Amazon. Monitor it on a regular basis. If you're concerned about the calibration of that blood pressure monitor, take it with you to your next visit at your doctor's office. And when they check it with that cuff, which is the most accurate reading that you can ever get, is a cuff. And you want to make sure when you get a blood pressure monitor, I always encourage my patients to get the blood pressure monitor that goes on the upper part of the arm and not the one that goes on the wrist. Okay.
Oh, okay.
So monitoring that blood pressure. Number 2, your cholesterol. High cholesterol is the second risk factor, right? So that means we have to monitor our cholesterol on a regular basis. So at least once a year, we're getting our cholesterol, fasting cholesterol panel, getting our cholesterol checked. But in addition to that, we're going to make sure that we do things that will help have us have healthy heart health, cholesterol health, having whole grains, avocados, beans. We talked about leafy green vegetables. All of these things are things that are very good for you and heart healthy and help to decrease your cholesterol level. So that's the way we're going to worry about, the high cholesterol. Number 3, diabetes. If you have family history of diabetes, you're at increased risk. There's several things that you can do to help decrease this risk. And one of the main things of that, we're getting right back to, guys, exercise. Making sure you're drinking plenty of water. Exercise. If you look at a lot of disease processes, exercise is tied to a lot of disease processes being better and not as bad because of exercise and what it does to your body when you do it on a regular basis. So if you're diabetic, or if you think that you could be, you need to visit your physician at least once or twice. And in actuality, I monitor my patients twice a year to make sure that they're not diabetic, getting a fasting blood sugar. Number 4, smoking. If you're not smoking now, please don't start. If you are smoking and you have family history or increased risk, try to get into, there are nicotine patches you can use. There's nicotine gum programs. There's medicine that we use and prescribe to get people away from cigarette smoking because of the risk that it plays with heart disease. Do something about that now. It's never too late. Even if you smoked a pack a day for 20 years, it's never too late to stop. What you're going to do by stopping is stop or halt the deterioration of your lungs and its effect also on your cardiovascular heart system. Last risk factors are family history. While you can do nothing about the genes that you have and who you're born with and the genes that you have and that what God gave you, can't do anything about that, right?
Right.
But what you can do is talk to your family who's had heart disease, talk to them about their experiences, the symptoms they had when they had heart disease, what age they were when they had their first knowledge of any heart problems at all, because that will tell you, we worry about you 5 years most likely prior to that. But let's say you're 20 years ahead of that. You can do something in those 20 years to combat the risk that you're at by being a part of that family by what we do environmentally. Are you going to prevent it altogether? Can you change your genetic makeup? No, you can't. But what you can do is make sure that you follow a better diet. You can make sure that you're exercising. You can make sure you're monitoring these things on a regular basis. You know, there's certain patients that have family history of high cholesterol and they eat well, they exercise, they don't eat fatty foods, and their cholesterol is still through the roof. That's family genetics. There's nothing they can do about that. But there is medication that we use for those patients in particular, that combined with them making the dietary environmental changes that they need plays a part in decreasing the risk of cardiovascular disease for that particular patient.
So speaking of family history, how far back in our family history should we look for heart disease?
In your family history, whether it's your mother, your grandmother, great grandmother, your uncle, your cousins, your aunts, your siblings.
My great
You can go back
grandmother.
you can go back a few generations, but we're more concerned with the first 3 or 4 generations.
Okay.
But definitely I still would ask to say, hey, did my great grandfather have heart disease? Because you know that predilection is there with you if they did.
Mm-hmm. Yeah.
Yeah.
So are those warning signs that we mentioned before, do they apply both to men and women? Are they equal, or is
No.
something more prevalent in men than women?
No. So the signs of a heart attack, that the most common signs that people get when they're having a heart attack: crushing chest pain, shortness of breath, left arm pain, neck pain, jaw pain, nausea, diaphoresis, or sweating all over your face. Men are more common to get the chest pain and get the left arm pain and the typical presentation for a heart attack than women are. Okay.
Wow.
Women can present differently. We also have breast tissue that are part of our apex or chest area. Sometimes that makes the difference. When you're getting an EKG on someone, it can make a difference here or there in terms of the ease in being able to get the best EKG, because an EKG it's a recording of what we call conductivity. So we put that lead on your chest while trying to see what's underneath and the activity of your heart, right? So women that have large breasts, that sometimes, not always, can be a little bit more of a challenge. So sometimes women won't present with the strongest signs and symptoms, and even an evaluation through, trying to get the best chest EKG, that you want to get, that can play a factor. So sometimes women just present with differing symptoms in a different way. For example, my mom, she did not have chest pain at all. She didn't have chest pain. She just felt tired and said, I felt slightly short of breath for just a moment. But the constellation or combination of the symptoms that she had, and with me learning about it at the same time, I was concerned about her heart, because I knew out of nowhere, just feel a little bit fatigued, feel slightly short of breath. And she doesn't have lung problems as a non-smoker. So I knew, okay, we have to be worried about her heart. And it turns out that a lot of times women will present that way, that something is just not right. Now, in addition to that, patients that are diabetic, sometimes, and this has to do with the nerve supply issue that sometimes happens with diabetics as well. Diabetics are more at risk for developing a nerve disease called neuropathy that they can get in their eyes, as well as in their feet. And so diabetes or high sugar levels can affect your nerve supply and the way your nerves function in your body. So having said that, sometimes people that are diabetic don't present with the strong symptoms of a heart attack, like severe chest pain, left arm pain, etc. Sometimes they just feel tired or get an overall sense that something is not right.
Goodness. Okay. Well, that's good to know, because I think we often hear about the left side I think, going numb, I think, or like there being pain. That's what you were telling me. That was more
Right.
prevalent in the men.
Mhm.
And women, I feel like, already have to go through this stigma of being stronger than they really are. Like people
Mhm.
always thinking that women, African American women, just women in general, being stronger than they are, and like not, and downplaying the issues that the medical issues that we face. And so
Right.
we have to be that much more proactive to just champion for our own health causes, and
Mhm.
really be vigilant over the signs, the warning signs, and then be preventative. It sounds like I feel like the main thrust of what you've been saying regarding preventing heart health is being preventative. Just really
Correct.
monitoring your blood pressure and like what you're
Exactly.
eating, your diet, and your exercise, and all of that, to
Mhm.
just curb that, like hit it head on before there is a problem.
Correct. Absolutely.
So that brings us to our last question of the day. And it is a question I think that is really appropriate because we've been talking about family history, we've been talking about genetics and whatnot. And one question from a viewer or a Wink Nation member has been: can my heart healthy habits today reverse the heart health of my family for generations, effectively breaking the curse?
So that is a very good question. Um, can you reverse your genetics? So the answer to that question, and the real answer to that question is no, you can't reverse your genetics, because your DNA is your DNA, and you have, just like in you, Jessica, you have an XX chromosome, right? So your DNA is already set. So whenever you have a child, if you haven't already, you're going to pass on that X chromosome on to someone else, right?
Right.
You're going to pass on that X chromosome to
Right.
someone else. And the genetics from your family are going to pass on to that. Now, you can help to alter how the things environmentally, you can make a difference in your cholesterol levels by what you do. So you can in that sense. But it depends on the genetics of your body. There are certain patients that have high cholesterol that is such a strong genetic component that the way that their bodies deal with cholesterol is different, right?
Right.
Than other people do because of their genetics. So can you change that particular part? No, but you can change things like a condition. Have I seen patients that have family history of heart disease go on and have some siblings or children that don't? Absolutely, based on the things they do environmentally. But does that change the genes themselves that can predict them to that? No, it doesn't. So it's a twofold kind of answer there. And then environmentally, you definitely can affect it. But do you understand what I'm saying? If that makes
Yes,
sense.
sounds like so like even with like I said, my dad is suffering from heart disease, and he does the necessary measures to like combat it, and he changes how he eats and whatnot, but it's still in part of his DNA. And then he has me as his daughter.
Right.
It doesn't mean that I can go just skate by with
Right.
doing what I want to do because my dad has beat
Correct.
it. I still have that gene, yes, and I have to
Correct.
do what I have to do, right, in order to combat
Right.
it.
Absolutely. Absolutely.
So the name of the game still is you have to be preventative in how you're approaching heart health, how you want to love your heart, and really prevent heart disease if you can. But even if you are born, let's say, with some sort of heart defect or whatnot, there are still measures that you can take to treat it, to combat it, and they can be medical intervention as well as environmental
Correct.
interventions, right?
Exactly. That's precisely it.
Right. Well, Dr. Celeste, you have been absolutely amazing. This has been so educational. I've learned so much. We are in our 8th year of doing Wink Goes Red. Yes, we're in our 8th year of doing Wink Goes Red, and we haven't quite done it like this. We usually try to go out into the neighborhood and do some sort of heart health demonstration, where we're cooking or showing some sort of exercise regimen, or just bringing awareness to the community in some kind of way. And to have someone of your caliber of expertise be able to contribute to the efforts of WINCgoesRed and Workmanship Incorporated is just such an extreme honor. So thank you so much. We really appreciate your time. If you would, can you tell Wink Nation how they can be connected with you on your social media or any other thing that you want to share with us about what you got going on?
Oh, absolutely. Thank you so much, Jessica, for having me. I absolutely enjoyed it. I love talking about different health issues and sharing the things that we need to do to improve our health on a regular basis. So it's been an absolute pleasure to be here. Thank you so much for having me. If anyone wants to follow me on social media, please feel free to follow me on Facebook or on Instagram, same handle at Dr. Celeste MD. That's DoctorCelestemD. If you're interested in telemedicine or COVID-19 testing, you can visit our website at drcelestemd.com. That's DoctorCelestemD.com. Thank you.
Thank you. And Wink Nation, thank you again for tuning in with us for this special exclusive broadcast of WINCgoesRed Computer Love. Yeah. So thank you again. Please take all of these comments to heart. Leave us some comments in our chat or in the comment section if you're watching on YouTube. And go on, love your heart, live heart healthy, and really embrace everything that has been done and talked about today. Thank you and have a great day. Love you all.